Chapter 11, Nonprotein Nitrogen. The renal system has an important part in maintaining substances in the human body and eliminating waste products. Please review urinary anatomy. The main portion that we are concerned with is the nephron. It is the functional unit of the kidney. We have 1 to 1.5 million per kidney. This gives you a close-up view of it. Non-protein nitrogens are products of the catabolism of protein. They have the nitrogen molecule, but they are not a protein. The main waste product that we're concerned with is what we classify BUN, or urea. The kidneys will excrete 75% of non-protein nitrogens because they're waste products. This table in your textbook shows you the percentages of where most of the nitrogen will be coming from, and as you can see, we have the most of it from urea. We call this BUN, blood urea nitrogen, in the United States. Elsewhere, they'll just refer to it as urea or urea nitrogen. We're concerned with the glomerular filtration rate, GFR. It is the volume of the plasma that is filtered in the nephron through the glomerulus per unit of time. So it will be resulted as mils per minute. There is a direct relationship between the volume of urea and your glomerular filtration rate. The glomerular filtration rate will be normal to increased, meaning that the patient is well hydrated, and about 40% of BUN is going to be reabsorbed, therefore excreting 60%. If you're well hydrated, more BUN is excreted, which will result in a lower serum BUN, which is what we want. In a dehydrated patient, more BUN is going to be reabsorbed and less excreted. Therefore, your serum, your BUN, is going to be increased, which will begin to be indicating a problem. BUN is affected by different variables, obviously the amount of urea and the filtration rate and hydration, as we just indicated. Terms you need to know are uremia, indicating an increase in BUN. AZOTEMIA means there's others also, and it's classified into 3 categories. We have pre-renal azotemia if the problem is before the kidneys, such as reduced blood flow. If it is renal azotemia, it is a kidney disease. Or you can have post-renal azotemia, meaning after this nephron, somewhere you have an obstruction in the urinary tract. Decreased BUN can occur with low protein intake or severe liver disease, overhydration. It does occur in pregnancy. And there's a syndrome classified SIADH. It's an inappropriate ADH secretion, which we will get into this in our endocrinology chapter. Testing BUN, most methodologies are enzymatic and they use the enzyme urease to break down the urea. And here we have formulas showing it, and you can see where urea plus your water molecules, the urease will break it down into 2 molecules of ammonia. Then this is taken and further reactions occur with different methods. The main method that we want to be concerned with is the glutamate dehydrogenase procedure. It's the most common one, and we're measuring the amount of NADH that disappears. It will be a decrease in absorbance as it's oxidized. And I did indicate that blood urea nitrogen is what we term it here. Originally started with a whole blood, but we do not test whole blood. We test serum or plasma. And in some of your literature, especially your QC or reagent package inserts, may indicate urea nitrogen rather than using the B as we do. Another element is creatinine, indicated CR. It is synthesized in the liver from amino acids. Creatinine is a waste product from creatine and creatine phosphate. Does creatine phosphate ring a bell? From the heart. This is a waste product that occurs during muscle contraction. Creatine? Creatine production is very proportional to your muscle mass. It's released at a constant rate. It is easily filtered by the glomeruli, and it does not reabsorb. Therefore, it makes a good glomerular filtration rate indicator. We use it often to verify if specimens are urine, such as in the case of a drug screen specimen. Methodology for creatinine includes the original Jaffe reaction. Be comfortable with that name. Jaffe reaction consists of creatinine plus picric acid to make a red orangish color. We will be doing this in laboratory. It is a kinetic method, and we're going to utilize it because it does reduce interfering substances. Another enzymatic test uses creatinase, which is listed here. The Jaffe reaction is the oldest, most commonly used. Once you get the picric acid on you, it stays for quite some time. Often, urologists will take a ratio of the BUN value to the creatinine value. Normal BUN creatinine ratio is 12 to 20 to 1. So we're expecting 12 to 20 parts BUN to 1 part creatinine. In renal disease, you will see that they're both elevated. Therefore, they'll still fall in the normal range. In pre-renal azotemia, you'll see a higher BUN and usually normal or just slightly normal creatinine. Therefore, this ratio will increase. If you have a high ratio and an elevated creatinine, it's indicative of an obstruction, or it could be pre-renal with additional renal disease. This chart will kind of help you see that. Looking at the ratio over here, indicating the top one is higher, the BUN is elevated, and this one indicates they're both elevated proportionally, and over here, usually your creatinine is excessively high. Another product that we look at is uric acid. It is from the catabolism of purine. And I listed man and higher primates. We will occasionally work in a laboratory that utilizes specimens from veterinarians' offices. And if you happen to be one of those lucky ones, dogs do not have uric acid, so don't be surprised when they come up nothing. It is produced in the liver, and here shows you the reaction that occurs. It is from diet for the most part, but most of it is excreted in the urine, and what isn't, it is degraded in the GI tract. Elevated uric acid is listed in box 11.4. Obviously, if we have excess in diet intake, we're going to have excess. In the portion that we do produce it, if we're overproducing it, we'll elevate it. Or if we're not getting rid of it. Or if there's some defect in the enzyme that's supposed to be breaking it down. You may be familiar with the condition of gout. We have an overproduction or under excretion. It is an inborn error of metabolism. It predominantly displays itself in males from 30 to 50, 7 times more common in men than women. The urates are excess and they precipitate out and they make crystals that are deposited into the joints. So they have a lot of pain, indicative of arthritis. This used to be classified a rich man's disease because they had a high diet on organ meats, and these have a high amount of